it works. Alright. This video here is just to explain how to do the what's our system, our new system. We are still changing a few things, and we are trying to adapt to see what's the best for the DAs. Alright. So I created this system. Now we have different colors, but I'm gonna change to numbers. Okay. So we're gonna have numbers 1, 2, 3, 4, 5, 6 here, and each drawer we have different. We have one specific procedure in mind. Like this is for check up and clean, and to clean the room. Okay. The drawer number 2 is this one. Is just for fillings. Number 3, root canal. 4 and 5, prosthodontics, crowns and bridges, and the last one for surgery. Okay. This side here, there is one that we use a lot. This is the second. The first one you can use at your will, as you wish. Let's say if you need, if you're organizing the day, you want to put the materials for the next appointment, you can leave it here. Okay. And the second one of this drawer here, yeah, I'm recording and explaining to them at the same time. And here we have the anesthetic and everything that we use all the time. Okay, so it may change in the future, but at least you have an idea of what's behind that. We want you have everything that is related in the same place to make your life easier. So that's why thinking about having a better life for the DA, we have this system here that you're gonna find. Oh, let's say that this is all that some of the material that we can find in the drawer number 2 here. Okay, and then we're gonna have this the number here. I'm considering, instead of using this, having a big one here. And so you're gonna have everything there, and you can discuss with the dentist. Oh yeah, there's a filling to do. What do you need? And the dentist is says, oh, I need this, and this. Okay, and then you just grab everything. Everything stays here. This bench here, dentists are not allowed to touch. Okay, and either you because with the gloves. This is a clean area, okay? So you're not allowed to touch with if your gloves are dirty. We have the clean area. Let's say that we have this one. We don't need the bib. Yeah, we're gonna use this. Let's say this one is for crown cementation. Okay, crown cementation. We're gonna cement a crown. Okay, it's a veneer. So you put the veneers. This is the train, and this is the cement. You leave the material here. You talk before you select everything. You can have a quick chat with the dentist. Before all of this, you're gonna wipe with alcohol. Okay, just wipe, and then you can put everything on top, and then you use this area here as your clean area. Every time that you put it back, you need to put it back in the same place. Surgery 1, surgery 2, because they are mirror. So in a way that you all of us, we need to when we think, oh, where is the bone, where is the edge, it has to be always in the same place. Okay, so you can work in different rooms without problems. Right? So this area here is the clean area. This is the rubber dam kit. Okay, always that we're doing a filling, the rubber dam has to be here. Okay, we have more material for rubber dam. It should be here. I forgot to put it there, but as you use, you're gonna know where is everything. We have some rubber clamps here, and in the other room is the same. Oh, you can find the rubber dam is here. So, okay. This is the transfer tweezer. The transfer tweezer area is where you're gonna pick things from here to you're gonna use this area here to you're gonna pick everything that you need here and put it in a dirty area. Dirty area, it's dirty, something that you can pick with your gloves, and it's not a problem. Please don't do this. Imagine you have the bone here, and you're gonna do a filling. Yeah, you see there is something that should be here. It's not, because we're still learning. But there is this small. Let's see what it is. This is the problem when we don't have things in the same place. It's here, so it's wrong. You see, and this is the problem that I want to fix. I don't want to have this kind of problem again, because it's a waste of time for us. You know that this one you're gonna touch, the dentist is gonna touch, so you can leave this one here. Okay, it's a filling. You leave this one there. Okay, before it starts, you're gonna open the bone. Can you see? Yeah, you can see that. And then you put it here. Okay. Once it's there, you imagine if you're wearing gloves, your gloves, you shouldn't have touched anything there. But as a rule, don't use anything here with your gloves. Okay, use just rub with alcohol first, and then you can remove the gloves, rub with alcohol, and then you touch here. Okay, then you can drop the bone. The bone goes back here. Same thing with composite. You can put the composite. Use the spatula here, and just without touching there, just put the composite there, and the composite goes back here. The composite doesn't go there. Okay? Everything has to be handy for you around this area, and not here. Here is just what we're going to use. Okay? But if the dentist, it's a class 2 and it's difficult, and the dentist requires another band. This band should be here, okay? And then you bring it here, or you bring it here, and then you grab and then give to the dentist, okay? But we need to have this flow here, okay? If you don't have the flow, we're going to contaminate, and once you have cross-contamination here, then we don't know where the bacteria and the virus are, and it's a big problem. Make sense?
Mm-hmm.
What I'm saying?
Mm-hmm.
Questions?
Yeah.
Anything that we need to clarify?
No, I think it's clear enough.
It's clear?
Mm-hmm.
If composite you with the spatula,
Okay. Let's say that we are in the middle of a procedure. Okay. In the beginning of the procedure, you need to talk to the dentist. Have a look how big is the filling. Please don't. What I've seen multiple times would be putting a lot of composite for one small filling. So usually, what I see here, we can do 3 fillings with the same amount, or with that amount of composite. There's a lot of waste. So have a look. Some different dentists may use different techniques. Sometimes when it's too cosmetic, for me, cosmetic fillings, I use 3, 4 different composites to reach the standard that I want. When it's posterior, I just use one color. Okay. So let's imagine we are going to do we are doing a filling here. Okay. So think that if you're using gloves, if you're wearing gloves and your gloves are dirty, if you touch anything here, you're going to contaminate. Okay? So that's why you need to plan ahead. Okay? Plan ahead with the material that you want. Okay? I just hand rub my hands. Let's do this. This is another problem. We shouldn't have this problem, but I understand that we have many new DAs here. So one thing, we don't use this for DA kits. Okay?
Oh, this was Kay's idea. She said that we should batch everything.
No, we don't need to
Okay.
batch everything.
Mhm.
We need to batch everything that we're going to goes to the patient's mouth.
Mhm.
Okay, this and goes in contact with blood. If it's just this, no,
We don't need
because it's not going to be in contact with blood. Okay, this one we don't need. And the DA kit has one mirror, one spatula, and one tweezer. This morning I had there was a
Right.
tweezer missing.
Mhm.
And this
Maybe
is
this
was probably this one. Okay, so we need to pay attention to that as well. So let's imagine that this is the tweezer. I don't want to stop the recording. Fillings. Then we have. Let's grab this. Let's say it's a cosmetic filling, and then we have a filling here. Do you prefer in the middle of the procedure or in the beginning? I think in the beginning is easy, no? You're not
I
wearing
think
gloves.
so too. Mhm.
And then the other thing, do you know that this part here is for you to do this? It's not for your back. It's for this, for you to rest your arm here.
Like balance too.
Yeah.
Sometimes you're doing like this.
Please come back after a few months if you want to get.
I hope it's still working. Not yet, it is. Okay, so I'm assisting. I'm the assistant here. So let's say that I'll never use anything, any wrist watch, or anything like that. So you're assisting the dentist requests a new material. What are you going to do? If you touch here with your gloves, you're going to contaminate. Okay. Okay. Imagine this one is the spatula. So this is contaminated already. All of this is dirty. This is halfway clean, halfway dirty. Consider that during the procedure you're gonna hold this to retract the cheek to help the dentist. Eventually this one, you should consider that this half is clean. If this half is clean, you can't touch. You can't touch here. You can't put this. You can't take anything to the patient's mouth with this tip here. Okay, so this half is clean. The same thing with the spatula. The spatula, the half of it is clean. So you need to pay attention. So let's say that you need to have a system. Let's say that you do this, okay? And then you know that this part is dirty because you touched, and this part is clean. You have to have a system, okay? So to put the composite, this is clean. This is dirty. Clean again, okay? What you can do, just this, okay? It's better with without. The best would be removing both to do this. Something you can do. This is dirty, dirty. Half is dirty. This is the spatula, okay? And you pick here. There. Come on. Okay. Back here. Back here. And then you pick another one and continue.
Mm-hmm.
Alright? If you're in doubt if you're going to be able to do this or not, just the glove. Don't think about the safety of the operation. Okay? Don't contaminate the material, because if you contaminate the material, all of us are at risk. Okay? Because we are going to open and close the drawers, and by the way, I think we have to have a routine of cleaning the holders.
Mm-hmm.
You know, with this is something that we need to do routinely as well. You know, cleaning with the wipes. So this is an overview how to use the clean area, dirty area. Make sense?
Mm-hmm.
Any questions? All good?